Coming up on NC Impact, veteran suicide is an ongoing public health concern. I hope you'll join us for this NC Impact Town Hall, where we'll dive into the untold stories of our veterans and their journey towards mental well-being.
NC Impact is a PBS North Carolina production in association with the University of North Carolina School of Government. Funding for NC Impact is made possible by
changing the course of people's lives. That's the impact UNC Health and the UNC School of Medicine work to deliver every day. Our 40,000 team members across the state of North Carolina are committed to caring for you, our patients and communities, as well as educating the next generation of healthcare professionals. Individually, we can do a little, but collectively, we can do a lot to create impact.
Hello, and welcome to NC Impact. I'm Anita Brown Graham. Veterans in North Carolina have an average suicide rate 2.5 times higher than non-veterans. In fact, studies show that individuals with PTSD or traumatic brain injuries are at an even higher risk of suicide. NC Impact's David Hurst introduces us to a program that is helping to bring healing to our heroes.
Having served in the Army for 29 years, Samuel Rodriguez can relate with the veterans he works with.
A lot of times they look and they feel downtrodden. They've been struggling. They've been looking for answers.
Rodriguez is the Veteran Outreach and Program Coordinator for the Thrive Program. The Thrive Program is a clinical outreach program that works to promote overall wellness for veterans by treating traumatic brain injuries and PTSD.
We hear things like, I'm here because I got tired of duct taping my life together, and I need some answers.
The program is a partnership between UNC Chapel Hill and UNC Health. Veterans start with a 3-day evaluation with upwards of 12 on-site specialists.
And we've also helped a lot of people just after that 3-day assessment, really by telling them that they're okay. They're not broken.
And that's one of the ways you stay oriented.
If the veteran is a good fit, they start on a 3-week outpatient program meant to give the veterans the tools and resources they need to thrive. The Thrive leadership team says this process usually takes months, if not years, within the VA system.
The whole goal here is to invite individuals who feel that they need it, or family members who feel a family member needs it, provide them the tools to take care of themselves and better themselves, and then make sure that they integrate back into the community that they're from.
The vast resource network includes several schools within the UNC system and even outside organizations. Veterans have access to these resources and receive follow-up even after their 3-week outpatient period.
To see the life back in their eyes again is extremely rewarding.
Since beginning in 2021, the Thrive program has expanded to serve first responders and hopefully soon civilians. For Rodriguez, that means more stories of hope for those he works with. For NC Impact, I'm David Hurst.
Scott, that was a really heartening story, and yet it alluded to some of the barriers and challenges that veterans face in accessing mental health resources. Help us unpack what's going on here.
Well, thank you, Anita. First of all, I want to thank you for inviting me to this important discussion today. It's one that we need to have more often. And so whenever I can be a part of this, I really am honored. I'm also honored to be on stage today with my 2 esteemed colleagues. I got a chance to meet them. This is part of their life's work. They're really the experts here, and so I'm here to listen and learn as much as anyone. When talking about the things that we just heard, especially the Thrive program, funding obviously is a major factor, but this is a multifaceted situation. Besides funding, there's other barriers to helping people seek the care that they need. Just a few that I can think of I'd like to point to today are stigma. One is stigma. When it comes to mental health, not just in the veteran community, all of us, there's a block between wanting to admit that that you need some help when it comes to well-being or mental health concerns. If you break your arm, if you have a cold, you go straight to the physician. But when you have a concern like this, it can be something that's challenging to deal with. It can be embarrassing. There can be a lot of different aspects to it that we need to remove. So that's certainly one of them. Another one would be sort of just the transition from military to civilian life. It's a hard one. You think about it, you're gainfully employed, you've got a purpose sort of in that work community, you've got a social network. All of a sudden you come out of that, and now you're just sort of in this void, and you're not really sure who to turn to, how to connect the dots, where to go for help, where is it safe? That stigma that we talked about in that piece as well too, you could be worried that if you bring these things to people's attention, that it might hurt your ability to stay employed or to get redeployed if you're still in the military, or to re-enlist, right? That could be a concern as well too. So people hide it. So that transition and that stigma. And then also, even if funding is all in place, access and geography. There's people that are, we have people that are military come from all walks of life, all aspects of the country, and are we going to have facilities and treatment centers that are within an acceptable distance for them to be able to receive the treatment that they need? So I would say that those are three major concerns. We could get into just navigating the whole complex U.S. healthcare industry, but
probably don't have
those
enough
are
time
challenges
for that.
as well too. Yeah.
I do want to stay with the problem for a moment, though. So, Andre, what other unique challenges are veterans facing? There's a reason why we've got 2.5 times the suicide rate in this population. What else is going on here?
Well, I think, Scott touched on it with transitioning service members being one of the most difficult times in a service member's life. As he said, you're all wrapped up with everything, and then all of a sudden, it's all gone. And they call the first year of a service member when they're transitioning the deadly year because of that loss of support, of losing all those close relationships that you knew exactly when to get up, when to go to bed, what to wear, and what to do every day, moment by moment. And so all of a sudden, we're looking at that. And with our veteran community right now, we're looking at, 20 years of war as well. So we have a lot of combat veterans that we're looking at. We're just touching the end of our Vietnam veterans who are now, they're needing these services right now. They didn't get the respect and love that they deserved when they came back, so they shunned care. And now we're seeing them finally, they're at the point they need it. So they're coming back into the system. But by the time they come back, it's usually quite critical that we see that. So you've got combat, you've got the loneliness aspect, losing that support system. The military, it changes everything about you, everything about who you are. You're not the same person when you get out as you were when you went in. With deployments, multiple deployments for Afghanistan and Iraq, you're looking at high divorce rates, you're looking at moves, PCSing from here to there, creating no solid relationships there. Then looking at when you're getting out, what am I going to do? Where am I going to live? So there's a lot of things there that affect the whole totality holistically of the person, not even counting on the fact that they may have disabilities, they may have TBI, they may have PTSD. And PTSD doesn't always show up in the first 5 days. It may show up 10 years later.
Let me get you into this conversation, Chris. Your organization, Stop Soldier Suicide, has recently focused on research to better identify suicide risk among veterans. What is your team learning?
A lot, very quickly. So we call it our Black Box Project, and it's named after the flight data recorder model in aviation. Before those existed, the only way to understand what happened with aircraft mishaps was to get investigators on the ground, collect all the pieces, go to a warehouse and try to make guesses about that aircraft mishap. We're taking a similar approach to understanding suicide risk by obtaining donated digital devices from families who've lost service members and veterans to suicide and making forensic copies of those devices and putting them into a machine learning environment where we can recreate the last year of life.
Wow.
I think we all agree that we don't go anywhere without these digital devices on us. And so our inner thoughts, feelings, movement, health behaviors are tracked in these devices in so many applications. And far too often, people who are struggling hide that from their most intimate partners and friends. But those devices don't lie. They know the site you were on at 2 in the morning. They know the text you sent. They know the chat. They know the room you were in. They know if you're social isolating by not leaving your home 4 days a week. There's so much data in these devices. And so we've been fortunate to have almost 100 devices donated to us by families who've trusted us with their loved one's device, which you have to understand are almost a shrine to the family. Everything that was that loved one's is a shrine. And so to trust us with a sacred item like a laptop, a smartphone, or a tablet so that we can make a copy and apply it into a machine learning environment is a sacred trust for us that these families have blessed us with. So we've done some preliminary analysis of those device data, and in some cases looking at 12 terabytes of data, 500,000 outbound text messages.
My brain can't even get around
Yeah, I can't
these
either.
numbers,
And thankfully, I'm not a data scientist, but we have ones who can do this work with big brains to do it. I'll give you 3 things that we've already seen in the initial data. One deals with sleep pattern behaviors. We're seeing significant changes in sleep patterns 6 months and 3 months prior to death. Second is social isolation. They're getting small, they're staying at home, they're not going to the places they used to go at the 6 and 3 month mark prior to death. And then thirdly, anger and sentiment, the same thing in the same moments of time. So you put those 3 things together, and we now have a pretty clear picture that says 6 months prior to death, 3 months prior to death, they had really low points where they stayed home, they were very angry, and they weren't sleeping well. And it affirms studies that were done about 7 years ago by another company using a completely different approach, just looking at public social media, and they found the almost identical patterns. So for us, it makes us optimistic to say, how can we use those findings to improve outreach, client activation, and care delivery?
Because this is really about identifying before it
Absolutely.
happens. I want to come back and start with you. Veterans may experience a variety of stress-related disorders and challenges when reintegrating from the military to the community. NC Impact's Evan Howell visited the Veterans Life Center in Butner. It's a place where those returning home can make a successful transition.
It's a Hispanic Mexican grocery store.
Eric Wilson said he was on a rough road when he returned to the United States from overseas Army deployment in 2016.
Very chaotic. And then it's even worse when you don't have a friend.
Putting it into a retirement. Those are those things that you want to think about.
Wilson was later referred to the Veterans Life Center in Butner. They help veterans reintegrate into society. The 100-bed facility is designed to help those at risk and prevent them from falling into crises such as chronic homelessness, incarceration, or even suicide.
When I got here, I stayed in my room for a while. I didn't want to talk to no one, barely was eating, sad. I cried a lot when I first got here.
The center was made possible through a grant from the State Employees Credit Union and partners with local groups in the Granville County area. These partners come in to assist residents across a number of areas, including life skills, spiritual guidance, financial advice, and mental health. For his part, Wilson has thrived since walking in the center doors and is now pursuing a career in radiography at Granville Community College.
I found a group of people that actually believed in the veterans.
After John Turner read that 22 veterans were committing suicide per day, he said it was clear there was no system in place to address their needs, and that's when he decided to open the center in 2019. He says things like post-traumatic stress after combat deployment can hurt a veteran's chance of getting back on their feet.
I still have, when I drive down the road, if there's trash on the road, I'll switch lanes, because in Iraq, trash could be an IED. I still, 15 years later, will switch lanes.
For some, the anxiety of walking into a crowd or even a grocery store can become too much.
We founded the Veterans Life Center to solve the problem, to give veterans a place to come where they can relax, focus on themselves, not have to worry about paying rent, buying groceries, or anything else, but truly focus on themselves and getting the healing they need so they can go on to find their personally satisfying place in civil society.
Be student, but
Wilson is looking forward to his new chapter and says it wouldn't have been possible without the center.
the important things were supported, and my life has changed drastically in a year.
And meanwhile, the Veterans Life Center is seen by many as a possible model for others around the country, and a place to give our returning heroes the step up they need. For NC Impact, I'm Evan Howell.
Chris, that story emphasizes the importance of connection. If you're able to identify through this research the indicators of disconnecting, what do you then do?
That's a big question, isn't it? I mean, what we believe is that by understanding the critical pathways to suicide choices, and we can get left of those or in front of those, we believe we have greater opportunity to convince people that it's okay to not be stigmatized by mental health care and to raise their hand for care. What was so encouraging about these preliminary findings is I have time. 6 months is a good amount of time for us to try to change that course. 3 months is a decent amount of time to get people to have the courage to raise their hand, to seek help. And it gives us an opportunity. If the signals were 20 minutes or an hour, there's nothing that can be done. So the good news is the findings are telling us we have time. It's going to help us prioritize resources to focus on those who are most at risk. Because let's be fair that this is a tragic circumstance that happens to too many families in our country every year. But the vast majority of veterans are healthy contributors to their community, well employed. They coach the Little League. They serve on the PTO. They're thriving based on their military experiences that gave them a launch pad. And we want to see that for more veterans so that these numbers go down.
Scott, one important milestone for many veterans in reintegrating into civilian life is finding a job. What do you advise a non-military employer to consider when it comes to supporting veterans or the hiring of veterans?
It comes down to that, I'll tell you. We have a moral imperative to help our vets, I truly believe. And it's more than, as we talked about, it's more than just finding the job, but it's once they get there, having the right supportive environment to be able to help them and assist them as they grow in that space. So there's, from our point of view, we have a lot of understanding and awareness that needs to take place with how to interact with vets. We have supervisor training that we do in that space as well too. We have flexible work environments as well, not just for vets, but for others. I mean, that's something that's growing more as we transition to this remote and hybrid work space that we're in. Understanding reasonable accommodations for vets that might need them. Again, that comes as part of the supervisory experience. Employee Assistance Program and EAP. Having a really strong EAP is important. It gets again to that situation where someone has to ask for help, but an EAP has a lot of different pathways into it. An EAP doesn't cost the employee anything, or as we call them, teammates. They'll have set number of scheduled visits that they can have that are, again, zero cost, and then after that, our health insurance can kick in. It's not just for mental or burnout situations or well-being situations. It can be around finance, which we all deal with. We struggle with finance situations, or family, or marital issues. And so that we have a strong EAP that provides a lot of space. There's a new group that we're going to be working with too that's doing a lot of work with militaries around the world as well too, to try to help reduce the stigma. So our EAP is trying to get at the forefront of it, not just from a reactive standpoint, but from a proactive standpoint.
Questions from the audience.
How you doing? Question probably for you. I know the DoD spends a lot of money on mental health awareness, suicide prevention. We talked about stigma, but when the service members there's a stigma of like, I'm not going to ask for help. If I ask for help, I can't advance, I can't deploy, I can't promote. And so when people transition, we talk about getting a job, your resources for this, but we don't spend enough time talking to educating them about who you need to talk to when you're alone and isolated. Have you heard from your organization, is the DoD trying to invest in educating the personnel on the way out, like connecting with them right away and counseling them, not just one day, like, hey, this is your resource, we check in the box out the door, but truly educating the person on the way out, like, hey, you know these organizations are available. You know, these resources are there, because right now we're playing catch up, trying to find them, but if we can get ahead of it, and it's going to start in the DoD with bringing that education to the service members. So I just don't know if you've heard of that happening or if there's talks of that.
It's a great point. I mean, the DoD has a tremendous opportunity to improve the transition outcomes for veterans. They're the sole provider of veterans in America, except for the Coast Guard. So they have a monopoly on what happens when they leave the door. I know the DoD, I worked in the Pentagon for 2 different tours, and I was part of a couple offices that were focused specifically on trying to improve the transition experience and enhance those programs. I think they've made significant progress to improve the availability of those services. I think there's a long way to go. But I also recognize that the DoD's job is not to make civilians, but to fight and win our nation's wars, and that's always going to take priority. So it's a tough balance to maintain. Don't get me wrong. I think we as a nation have an obligation to do much better with how veterans are treated and supported when they've raised their hand. I have a member on my team who deployed 17 times. It makes me angry every time I say that. How do you send a human to combat 17 times and think that's okay? It's the sacrifice that he and many others made for our nation. So yes, the DoD can do better. Yes, agencies can do better. I think we all have a role to play to make that better. 1% of our nation serves, 100% of our nation can help on this problem.
Other questions?
So I served both as an active duty Marine and as a military spouse. And what I can tell you from my personal experience is that it was much easier to be the active duty Marine than it was to be the military spouse. And working with active duty spouses of Marines in Eastern North Carolina, one of the things I realize is when we're talking about the mental health, and I know y'all already know this, is the impact that it has on the family. So my question for you is, with the organizations that you work with and the work that you do, what kind of services are provided and available to military spouses? And then what are the ways that we can make sure that our military spouses have that information? Thank you.
Such a great question. Who wants to go first?
Ladies first.
Well, I was a military spouse and a veteran, and now I'm a caregiver. So I do understand that whole process, what you're talking about. And of course, we're also think about the impact of military spouses having over a 20% unemployment rate. So we're actively working on that as well at the state level, trying to find that portability. But we always encourage our active duty spouses to look at their local resources on base. You know, look at Military One Source, fantastic connection, lots of resources at Military One Source on there, as well as out in their local communities. Veteran service officers aren't just for veterans. All veteran service officers in our state are actively and open and willing to help anyone that touches the military community. The whole life cycle of someone that's in the military. From the day they raise their hand, they're there willing to help you with anything. Our job at the state and county level is to be that resource for all those touch points that you have, to help you with employment, social enrichment, connect you with your community and faith-based organizations. That's what we want to do. We're there 100% to support the military family, the whole culture around there. We want to be there. We actively work at the state level trying to work on child care and employment, because all these issues that we're talking about are suicide prevention. Everything we're talking about, employment, education, all of them are part of suicide prevention.
I'm struck by how often in this conversation we've talked about the need to talk, to be connected, to be able to say out loud and hear back from others. Scott, Andrea, Chris, I cannot thank you enough for spending time to share your insights with this wonderful audience. And of course, we don't ever close an NC Impact show without thanking those experts who showed up in those videos, who are willing to let us tell their stories. Thank you all so very much for being with us this evening. Thank you.
NC Impact is a PBS North Carolina production in association with the University of North Carolina School of Government. Funding for NC Impact is made possible by
Changing the course of people's lives. That's the impact UNC Health and the UNC School of Medicine work to deliver every day. Our 40,000 team members across the state of North Carolina are committed to caring for you, our patients and communities, as well as educating the next generation of healthcare professionals. Individually, we can do a little, but collectively, we can do a lot to create impact.